Question number 1. What should be done for a patient with nausea? The right answer is option B, offer ginger or anti-nausea medication. Question number 2. How often should vital signs be checked in a post-op patient? The right answer is option B, every hour for the first 24 hours. Question number 3. What is the main risk for a patient with a central line? The right answer is option B, infection. Question number 4. What should be monitored for a patient on pain medication? The right answer is option B, respiratory rate. Question number 5. How to prevent pressure ulcers? The right answer is option A, reposition every 2 hours. Question number 6. How should a nurse manage a patient with hypoglycemia? The right answer is option B, give sugar drinks or snacks. Question number 7. What is the first step in wound care? The right answer is option D, wash hands. Question number 8. What is crucial for a patient with a pacemaker? The right answer is option B, avoid using microwaves near the chest. Question number 9. How often should a nurse assess a patient's pain? The right answer is option C, before and after administering pain relief. Question number 10. What is the best method to prevent infection in a wound? The right answer is option B, cover with a sterile dressing. Question number 11. How should you handle a patient with a sprained ankle? The right answer is option A, keep them immobile and elevate the leg. Question number 12. What is important when caring for a patient on a ventilator? The right answer is option A, monitor and ventilator settings and oxygen levels. Question number 13. What is the priority when caring for a patient with a chest tube? The right answer is option A, check the drainage and ensure no kinks in the tube. Question number 14. What should be monitored for a patient with a Foley catheter? The right answer is option B, urine output and color. Question number 15. How to handle a patient with confusion or delirium? The right answer is option A, provide a quiet environment. Question number 16. What is the primary concern for a patient with a blood transfusion? The right answer is option B, allergic reaction. Question number 17. What should be done for a patient experiencing dehydration? The right answer is option A, offer fluids. Question number 18. How should you assess a patient's level of consciousness? The right answer is option B, ask simple questions and monitor response. Question number 19. What is the best approach for a patient with constipation? The right answer is option B, encourage high fiber foods and fluids. Question number 20. What is important when caring for a patient on bed rest? The right answer is option C, reposition them every 4 hours. Question number 21. How often should a patient on a heart monitor be assessed? The right answer is option C, continuously as per protocol. What is crucial when giving a subcutaneous injection? The right answer is option B, clean the area with alcohol before injection. Question number 23. How should you care for a patient with an amputated limb? The right answer is option A, keep the stump elevated. Question number 24. What is key when assisting a patient with mobility issues? The right answer is option B, use proper body mechanics. Question number 25. How to manage a patient with urinary tract infection? The right answer is option A, provide antibiotics as prescribed. Question number 26. What is priority for a patient with sepsis? The right answer is option A, administer fluid and antibiotics. Question number 27. How should you assist a patient with a fractured limb? The right answer is option B, immobilize the limb and offer pain relief. Question number 28. What should you do for a patient with a high fever? The right answer is option A, provide antipyretics and fluid. Question number 29. What is important when caring for a patient with a tracheostomy? The right answer is option A, keep the site clean and monitor for infection. Question number 30. What should you do for a patient with a burn? The right answer is option B, cover with a clean non-stick dressing.